Morley, and the issue is AIDS in Africa. And of course, Ms. Wyatt-Morley, it's more than just AIDS in Africa. We've talked about AIDS in Tennessee and as a national issue. And I don't think that we could have enough time to really deal with the issue as you are describing the issue of AIDS in Africa. But let's continue to talk about the impact that it is having on the continent of Africa.
Well, I brought the pictures by for you to look at and share with.
And of course, these are some of the images from your trip to Africa.
Exactly. Now, what you're looking at now are pictures from a clinic that we visited, as obviously this woman is pregnant. They allowed us to go into the maternity ward. So we were we walked straight in off the street, straight into the maternity ward. And then the next pictures show, I'm sure that those are the babies. It was really interesting to be able to walk in. A lot of these women were in labor. This is a ward, a clinic, a very, very small clinic, of which I intend to continue to support. And I am asking for the community to send donations, care of us, so we can send those donations to that clinic. This clinic is in need of everything. They need everything. As I said, we walked in off the street, straight into a maternity ward. There was no sanitary anything. There was no sterilization of anything. These women were in labor, babies being born while we were there. This clinic is in great need. So as I said, and this clinic is in Nigeria, as I said, there is a profound need in Nigeria.
Very good. And of course, this is also one of a mother with, now all these children are infected. I mean, all of these women are infected, is that?
Well, the woman that you're holding up now is one of the nurses holding one of the children that had just been born just that day. Some of these children are HIV positive and some of these children are HIV negative, which again leaves a note which ones are infected and which ones aren't. These are all God's children and they all need help. These women, there were no men in the ward at all. All you saw were women in labor. There were no men in the clinic.
No doctors or no orderlies?
There was one doctor who led us around and showed us the tremendous need, but there were no orderlies. She was a nurse, but she was not degreed. This clinic needs so much help. There wasn't enough linens. There weren't enough beds. There were women in labor that were sitting on benches. This clinic, it's a wonderful clinic. They try so hard with the small amount of things that they have. They just really, really need our support. We want to send them medicine. We want to send them money to be able to buy the things. We want to send them just sheets and bedding, the things that we take for granted here. Stethoscopes, they don't have those kinds of things. As I said, just the small things that we take for granted here, those people at that clinic really, really need it. Those women had nothing.
What has been the government's response to this, the Nigerian government? Are they trying to do anything, or what, is just overwhelmed by it?
Well, partly they are overwhelmed, because we did meet with many government officials about what they're doing, because we went over there on a fact-finding mission, wanting to know what the need actually was, what the government was doing, and we found that the government were doing several things, but the government encourages women's involvement. They have asked us to please come back and be supportive, bring programs over, help this clinic, and help people. So they are very much in need and very, very receptive to receiving the help. But they have to make sure that they trust you. The Nigerians that we dealt with really have a trust issue. But since we went over on a fact-finding mission, not asking them for anything, but going over there asking them what we can do to help them, they were very receptive in receiving us. We made many friends, as I said. We have offices over there now that are employed by Nigerians. And so we're really, really encouraging people here in the state of Tennessee to get involved with women so we can further help those people, because the need is absolutely tremendous.
And now this is all over the continent of Africa. And now you also mentioned earlier that you had I think you went to some Asian country. I think
Thailand.
Thailand.
Yes, yes, I have been to Thailand.
Now you are also involved there with this as a program, are you not?
Yes, yes. I was involved there with the United Nations, HIV and AIDS in Thailand, and worked with them for approximately 6 to 8 weeks I was over there. The need there is great also. It's not as bad in Thailand as it is in Africa. Accessing medications in Africa is one of the tremendous issues that are happening over there.
Medication is a real issue?
Medication is a real issue, and accessing that medication is a real issue.
Well, now that seems to be something that we should be able to deal with. In other words, the world community, perhaps working through the United Nations, should be able to create some kind of situation so that medication can be made available. That is a real problem.
Yes, it is. It is a real problem. The pharmaceutical companies, some of them are trying to step forward, many are not. And also, there is a level of corruption, and some of the medications are not getting to the designated areas by which they need to get to. So some of it is not being done on a grassroots level, and some of the medications are getting to chosen individuals. But these women and children, as you saw, are in great need, and they're not the chosen people, but they are, as I said, God's people.
Well, now, in the end, over the last 3 or 4 minutes that we have here, you've been working with this for many years now. What do you see as the ultimate outcome? It seems that each time you come, you tell us that things are probably getting worse. And well, what's the ultimate outcome of all of this?
I would say the ultimate outcome is education. There is no such thing as too much education. There is no such thing as too much HIV/AIDS support. We need money to bring the education. We need money to bring the message. We need money to bring the medications. We need government. The United States government needs to be more involved. Yes, they're sending billions of dollars, you know, to Africa on medications, but there needs to be someone making sure that those medications are getting to the right place. There needs to be more grassroots involvement, but the ultimate thing is education. There's just not enough education.
And of course, what we're trying to do here in this country is to provide some kind of loan, some kind of package for aid to Africa. I think President Bush and Senator Frisk have worked together in reference to that. What about that aid package? Is that sufficient, or will that be sufficient to at least meet the need? And of course, we can't do it all by ourselves.
Exactly. And the United States should not be held accountable to do all of it by ourselves. I agree with that. But no, that package is not enough. It's just not enough. When in the United States, 1 in 60 African American women are infected, that's not enough in the United States. And if we think that those rates of infection are extremely high, then rates of infection on the continent of Africa are quadruple that. When some communities, the whole village, are infected and children are born with no means of taking care of themselves, we need more money, more support, and definitely more education.
And more education.
Absolutely.
Education. So we just can't do enough.
We cannot do enough.
And that's surprising. That's the surprising thing about it, is that if education seems to be the key, education is almost the most inexpensive thing that we can provide.
Absolutely.
And it's through education. As a matter of fact, we were once told by Dr. Poco that education is important because AIDS is a behavioral disease, and the only way that you can stop it is education. Yet and still how should we approach this education thing then? I mean, what should we do? I mean, should we pour money into educational institutions, or what? How should we do that?
I think, in my opinion, it needs to be dealt with more on a grassroots level. There needs to be education infiltration. We need not take for granted that because I know something, you automatically know it. We need to start educating, especially here in the United States, our children at younger ages. We also need to begin to really put forth tremendous effort, not only to throw money at an issue, but also throw strong education and strong risk reduction education messages and materials in the United States as well as in Africa.
And so we can, you believe that in the end we can beat this disease.
Oh,
We're going to have
absolutely.
to.
Absolutely. Absolutely. As I said, I'm a person living with the disease, and I have been living with the disease for 11 years, and will continue, you know, to move forward. You can live with this disease, but it takes a lifestyle change, it takes education, and it takes a dedication and a commitment.
Very good, and you've got that dedication and commitment.
Absolutely.
And let me thank you for coming by. And as we
Thank
said
you.
before, each time that it certainly takes courage to do what you're doing, but to bring the kind of enthusiasm and the kind of passion to what you're doing, I think that that's more than courage. And we want to simply commend you for that. And let us encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.